The title of this lecture is Section 1 of the Professional Hypnotist course. This lecture is recorded by Dr. P. Goodwin, all copyright reserved. Now, it may help you if I tell you a little about my background to start with. I was born in Kent, England in 1938. I was educated in England, went to Southampton University, England, graduated from the Institute of Education, and then took up a commission in Her Majesty's Air Force as an education officer. When I left the Royal Air Force in 1962, I set up a practice as a professional hypnotist after taking several training courses in this subject. In those days, the profession of hypnotist was quite rare. I've practiced for 20 years and helped hundreds, if not thousands, of people personally and individually in my private practice. In 1977, with my wife, Dawn Goodwin, I founded the Institute of Hypnosis and Parapsychology. Parapsychology being the subject of extrasensory perception, which covers things like precognition, psychokinesis, telepathy, and clairvoyance, which is the study of people who have knowledge of other spaces in this universe simultaneously and at the same time. There is in fact an extension course which you can undertake after you've completed the hypnotist course, which is a professional parapsychology course. But this course, the professional hypnotist course, is concerned solely with what is needed and wanted for you to enter the profession as a hypnotist. There is also another course that you may take after this course, which is a series of colour video lectures, again of approximately 45 minutes, which show various types of live sessions and show me at work in my practice, where I show you some special techniques and some special processes. Now, it may help you if I distinguish between what is a technique and what is a process. Now, the technique is how you hypnotise someone. The process is what you do with the person once they have been hypnotised. Now, I have trained many hypnotists, tens of hypnotists, in fact hundreds of hypnotists, both in the United Kingdom and the United States of America, to enter private practice. Some of these hypnotists today are earning sums of money such as £20,000 or £30,000. In fact, the earning rate of a professional hypnotist is approximately £30 an hour. In the United States of America, this is of course approximately $60 an hour. Now, it's important to distinguish between the various main types of hypnosis. Basically, these are medical hypnosis and non-medical hypnosis. Now, medical hypnosis is the use of hypnosis for the treatment of disease, illness, or injury. In the United Kingdom, there are no rules governing the use of medical hypnosis. There are no restrictions, other than it is illegal to use hypnosis in England for the treatment of cancer. It is illegal unless you are a qualified member of the medical profession to prescribe drugs and use hypnosis with the prescription of drugs. It is also illegal without a physician's consent to deliver a baby using hypnosis. Apart from that, there are no restrictions in the United Kingdom. In the United States, all medical hypnosis, which is the treatment of disease, illness or injury, must be done under the prescription of a doctor of medicine, of an osteopath, chiropractor, or several other semi-medically trained individuals in their own speciality. There's no such restriction governing medical hypnosis in the United Kingdom at this time. Now, this course of lectures you'll find very comprehensive, because not only does it cover the techniques and processes and uses of hypnosis in your practice, it also guides you and schools you of how to set up a professional practice with malpractice insurance, professional indemnity insurance. It tells you how to get your clients, how to advertise, how to ethically practice hypnosis, how to produce the results, and how to earn a living, same as any other profession. Now, one of the questions that I'm often asked right at the start by one of my students is, will I be able to train to become a hypnotist? Will I have the necessary intuition? Will I have the necessary skills to make a professional hypnotist? Now, this is a fair question, and I'm sure people that have set out to become carpenters or to become builders have asked the same question. Do I have the necessary aptitude? Do I have the necessary intelligence? Do I have the necessary skills? I often compare the art of hypnosis with the science of driving a motor car. Most people can be taught to drive a motor car. Most people can be taught to become professional hypnotists. Teaching the technique of hypnosis is not very difficult. Now, the use of the processes of hypnosis, once you have hypnotized somebody, this is of course more difficult and requires more knowledge and more experience. And for those who want it, we do in fact have an 18-month apprenticeship with one of the senior practitioners in this institute, either in the United Kingdom or in the United States of America, whereby you can train for 18 months with direct supervision. Now, not only have I personally handled thousands of clients over the 20 years in my own private practice, I've also handled the clients of people who I've trained to become hypnotists by supervising their case notes. Therefore, the processes and techniques which I'm giving you in these courses have not been tried 2 or 3 times, or even 200 or 300 times. All the techniques and processes have been tried 2,000 or 3,000 times with direct results with a known track record. We do not put a technique out or a process in this institute unless we have tried it several hundred times and with several practitioners in various parts of the United Kingdom and the United States. Hence, you're not becoming associated with an organisation that is basing its results on 4 or 5 instances. We are basing our results on hundreds of instances, both in the United Kingdom and the United States of America. In the United States of America, I spend most of my time giving lectures and interviews on radio stations and television stations throughout the United States, although I've also appeared on British television and on many radio stations throughout Great Britain. But you can see the benefits of not only learning from someone who has personally carried out these processes and techniques, but you're also learning from the other people who have taken courses with the Institute, who are practicing their profession, some of whom are earning £20,000 to £30,000 a year in the United Kingdom, and who have submitted hour after hour of case notes, which has been supervised by this Institute. If you do well in this course, and you are selected, as I say, it is possible that you could be apprenticed to a senior member of this Institute for a period of 18 months, during which period you would have an earned income. And we'd be pleased to hear at the end of this course inquiries about that apprenticeship. Now, as I mentioned before, there is a course of colour videotapes which you can purchase, which show me at work in my private practice, and also a professional parapsychology course which deals with regression under hypnosis, the phenomena known as past life regression, and also the study and practice of extrasensory perception. There is just one note of warning I would give to my students who are studying this course, and that is, if you are buying the course section by section in 12 sections, then please complete the whole of the course before you carry out any practical work. The reason is, there are many things that you need to know at the end of this course which cannot be contained in the earlier sections. Now, if you, as I have hoped, taken the discount and purchased this course outright, then you do not have to worry about the safety factor, because you have the whole of the course at your disposal, and once you've studied the course and completed the course, then you may proceed to hypnotise other people without danger. I don't say the dangers are all that great. It is possible that you could put somebody into a trance which you may have difficulty in getting them out of unless you have completed the latter part of this course. Now, another question that my students often ask me is, can everyone be hypnotised? Now, views have changed about this in the last 30 years. 30 years ago, a professional hypnotist would answer this question by saying 80% of all people can be hypnotised to various depths of hypnosis. But in 1983, both those experienced in the medical profession and those experienced in the non-medical profession as hypnotists will tell you that anybody who is willing, anyone that wants to enter the hypnosis state, can, with a trained hypnotist, be hypnotised. However, he will qualify it by saying that not everyone will enter into what we know as the tertiary stage of trance or the somnambulistic state. Not everyone can be hypnotized to the point that you can conduct a medical operation or completely eliminate all pain at childbirth. But everyone can enter the hypnotic state. You see, when you're talking about the tertiary stage of trance or somnambulism or the hypnoidal coma, you're talking about something really which should be called something other than hypnosis. Yet, in the old days, when they talked about hypnotic trances, they talked about this deep state of trance and tended to neglect the value and the importance of the lighter stage of hypnosis. You see, in 1983, when we have video machines, when we have stereo tape recorders, it is possible for a client who has received one session of hypnosis to be given a tape and for them to go to their homes and use that tape 14 times in 1 week between the first and second session of hypnosis. Therefore, using a tape recorder, the results that you can obtain from the light and medium state of trance greatly exceed what the early experimenters in hypnosis achieved, because they only had the one session which they gave the client, which was live. The client probably only received a maximum of 2 sessions a week. So when we introduce the tape recorder, it's a true statement to say that everyone can be hypnotized, anyone that wishes to be hypnotized, but not everyone will enter into a hypnoidal coma or the state of somnambulistic trance. Now, there is a course that we can also extend to you after you've completed this course, which is the Professional Stage Hypnotist course. Now, the stage hypnotist operates in a different way to the individual who's operating a private practice. A stage hypnotist can only really work with people known as deep trance subjects. And therefore, those of you who have seen an exhibition of stage hypnosis may be led to believe that everyone can be made to enter into this deep stage of trance. But in fact, the techniques of stage hypnosis are entirely different to the techniques of private practice. And therefore, not everyone who comes into your private practice is in fact going to enter into a deep and final stage of hypnotic trance. Most of your clients who will come into you will ask you the question, will you be able to wake me up? And therefore it's useful to be able to tell them that most of the work you do or are going to do with them is using light hypnosis, and therefore they will be fully conscious and know what is going on at all states of the hypnotic induction. Hypnosis is not sleep, and hypnosis, except for very deep trance subjects, does not involve unconsciousness. The client or subject is entirely aware of what is happening at all times, but in an altered state of consciousness, using the deep relaxation of the physical body, and also using the sense of the imagination of the mind, and the use of suggestions, and the use of those suggestions to increase suggestibility. So to have hypnosis taking place, we need relaxation of the body. We need to change the breathing patterns of the client to help this deep relaxation. And we also need to work with the client's imagination and also to increase their suggestibility. But all hypnosis is done with the consent of the client or subject. The old-fashioned hypnosis of Svengali or Rasputin, exerting their will on the will of the subject, is a very old-fashioned viewpoint. Today, all hypnosis involves self-hypnosis. Even medical hypnosis involves self-hypnosis. It involves a complete cooperation of the client with the techniques and processes being used. Now, it's very important, even at this stage, even though we're not undertaking a parapsychology course, to look at the various parts of the human being. They are the physical body, the human body. Then there is the mind. Then there is the brain, the physical brain. And then there is that part of the person which exists outside the 3 dimensions of space and time. In other words, the actual being. If you look at a dead body, there is no being present. If you look at a live body or meet a live person, then you're aware that there is a personality which exists. As you will see from the Parachycology course, for those of you who undertake it, that person, that beingness, is a separate factor from the body, the mind, or the brain. But it's not necessary to worry too much about that whilst you're studying to become a professional hypnotist. But remember, all hypnosis is performed on the person. It's not something that's performed on their brain or their mind or their body. But you have to relax the body, you have to stimulate the imagination of that person, and also increase the suggestibility by using suggestions on that person when they are in the hypnotic state. Now, another question I'm often asked by my students is, how does hypnosis work? Well, we've only in fact discovered recently in the last few years how hypnosis does work. Now, all hypnosis is the result of the integration of the left hand and right hand hemisphere of the human brain. The act of hypnosis and the harmonizing of these two hemispheres results in electrical changes and chemical changes in the brain. Now, these electrical changes are measured by an EEG machine, and what we find is that we have a production of a brainwave of a certain frequency. Now, the brainwave frequencies are quite arbitrarily divided up, rather like the wave bands of a radio. In fact, the division of the brain waves into alpha waves, beta waves, delta waves, and other forms of waves is purely one of convenience. What happens is that the brain can produce waves of different frequencies, and all we have done is take certain sections of these frequencies and give them Greek letters so that we know alpha waves or alpha rhythms are at a defined frequency. It's not very important what these frequencies are, but these frequencies are given out by both the left hemisphere of the brain and the right hemisphere of the brain. Now, during the hypnosis state, the left-hand side of the brain and the right-hand side of the brain are balanced. Now, basically, you can regard the left-hand side of the brain as being associated with your conscious self, and the right-hand side of the brain as being related to your unconscious self. Well, we also know that after the induction of hypnosis, chemicals are released in the brain called endorphins. Now, these are hormone-type substances which can, in fact, change the physiology of the body. In large doses, the large production of large doses of endorphins can render the body completely anaesthetized to all pain and to all physical sensation. And in certain cases, this can be as strong and as effective as an anesthetic, although the person can have their eyes open and watch and record all factors of a medical operation under hypnosis. But as I say, this is not too common and can probably only be induced in about 5% of subjects. This is the tertiary stage of hypnosis, where the endorphins are produced in such quantities that it's the equivalent to giving someone several injections of morphine or some similar type analgesic, which has completely paralyzed the whole of the central nervous system, but doesn't in fact affect the consciousness of the individual. So we do in fact know that when hypnosis has taken place, endorphins are produced. These endorphins are also mood elevators, and they can alleviate depression. A lot of the pharmaceutical companies today produce harmful drugs which are said to help depression, and they in fact work in the same way, in the sense that they can stimulate the production of endorphins. The only problem is that when you cease to take the antidepressant, you cease to produce endorphins naturally in the brain, and therefore you undergo severe withdrawal symptoms when you stop taking the antidepressant. Whereas if you have been taught to control your own endorphin release, and also taught to monitor the brain waves in the left-hand side of your brain and the right-hand side of the brain, then you can produce harmonious existence without the use of drugs, and you can control and elevate your own moods at will. However, the drug companies are out to make a profit, and they're out to produce pills that will produce changes in consciousness without any responsibility for the side effects or after effects or the addiction of clients or patients who have been given these psychotropic drugs. There is in fact a whole lecture later in this course on psychotropic drugs, so I won't go into that section too much now. Just to say that the hypnotic state is the synchronization and the harmonization of the left-hand hemisphere and the right-hand hemisphere of the brain, with the right-hand hemisphere being associated with the subconscious mind and the left-hand hemisphere being associated with the conscious mind. So somebody who is hypnotized can receive a suggestion or a message which can be recorded by both their conscious mind and their subconscious mind simultaneously and at the same time. Therefore, it is rather like putting an overdrive on a motor car. You've got an extra gear there which you wouldn't normally have had you not trained yourself in self-hypnosis or had you not been hypnotized to produce a state of self-hypnosis. Another question I'm often asked by my students is, will I always be able to bring my client out of trance? Well, this is the only danger in releasing to you a course in parts, because although generally you will be able to bring your clients out of trance, a certain percentage of your clients you may find difficulty in bringing out of trance. And therefore it's important that you study some of the later sections of this course which tell you how to handle those special cases. Basically, there are special techniques for bringing people out of deep trances who won't come out of those trances naturally due to an excessive release of endorphins into their brain and body system. But generally speaking, most people will come out of trance, and all people who come out of trance, whether they've been in a light trance, a medium trance, or deep trance, will always tell you that they feel wonderful, they feel as if they've had a night's sleep or 2 nights' sleep, they feel wonderfully relaxed, they have no anxiety and they have no stress. But as I say, the later sections of the course do handle this, and therefore I would impress upon you, if you are pursuing this course on a section basis, to get hold of those sections before you start to hypnotise other people during this course. And one of the important things about being a professional hypnotist as opposed to being an amateur hypnotist is that each thing that you do or each action that you perform with your client is of a standard technology. The technology we are going to give you during this course will be absolutely standard, and it can really be compared to having a series of golf clubs, and that when presented with a certain situation, you would use a certain golf club on the golf course to play a particular shot. You may use a putting iron or you may use a driving iron, whatever, and these irons have different numbers and are different shapes. And it's rather similar with the techniques of hypnosis. You have a series of techniques which you can use on different types of clients, and you will also use different processes. For instance, if someone comes in with a nail biting problem, or someone comes in with a smoking problem, then you would use the nail biting process on the nail biter and the smoking process on the smoker. You may use the same or a different technique for hypnosis before you use the process, and then you would bring your client out of trance using one of several methods depending upon the situation and conditions presented to you. But you'll always know what to do, because in later sections of this course are included complete sections of processes. With this first section of notes, you have some typical induction techniques which are described in detail. In fact, when you're starting off in the profession, it's perfectly permissible to hang some of these induction techniques on the wall, and you could more or less read them off the sheet. This is rather similar to listening to a play on the radio, when the various characters would stand behind the microphone in the studio and read off a sheet of writing when they are playing their part, along with the necessary acoustic sounds and noises in the background. So it doesn't matter if you cannot memorize these processes, you can certainly hang them on the wall and the client has got their eyes closed. Now notice throughout this talk I'm using the word client. Really, a person is only a patient if they are referred to you by a physician. As I said, in various parts of the United States, it's usually necessary to get a prescription before you would perform any medical hypnosis on a doctor's patient. But in England, this is not yet a requirement, but you will get referred patients by doctors. So if the doctor has referred you somebody, they'll probably be coming to you as a patient. But most of the people will be coming to you as clients. They will not have any disease, they will not have any illness, and they will not have any injury. And they're likely to get upset if you regard them as sick or you regard them as patients. Now, we have an important section on this course on alleged mental illnesses. The Institute does not support the theory of alleged mental illness. In fact, in the absence of a diagnosed disease, or in the absence of a diagnosed brain injury, or in the absence of a diagnosed illness to the brain, we will regard all individuals as fully functional. Now, we realise that people have different IQs, which is really something which is associated with the left-hand side of the brain. Just as important that people know how they differ in IQ, because some people have high IQs and some people have low IQs. Most of us have IQs in the middle. The bulk of the population has a normal IQ, but some special people have an high IQ, and some people have a low IQ. As far as the right-hand side of the brain, some people can make more use of their subconscious mind than others, and some people can make less use of it. But we can all make what we can regard as a normal use. You could say that probably something like 75% of the population have mediocre IQs, and about 75% of the population can put their subconscious mind to useful effort if they are trained how to do it. The trouble is, we're not trained how to do it, because hypnosis is not taught in the schools. Until such time as hypnosis is taught in the schools, then we will still be turning people out from schools who are misemotional, in many cases emotionally disturbed. It's also true when we talk about the psychic factor. We all have ESP ability. Some of us have more ESP ability than others. Most of us have an ESP ability which is about average, but we can improve it and we can develop it. We can improve IQ, we can improve the way we use our subconscious minds, and we can also, as you will find out, should you take the Parachycology course, we can also improve our ESP factor. Another very important point to impress upon your clients is that the client who comes to see you does not come along for a single session of hypnosis. In fact, when any client comes into your consulting room, as you will learn from this course, the first thing you do is carry out an initial consultation to find out what is needed and wanted in order to advise the client on what course they require. But all courses are courses in sessions of hypnosis. We do not try to do anything in a single session. This would be ineffective, because what we are trying to do here is to educate the client on how to make maximum use of their subconscious mind, and this is done by a series of courses. There are, of course, lessons or sessions of hypnosis which make up the course. It's very important the client purchases a course, not a single session of hypnosis. This is why we go into the area of case fees, and it's why we take a substantial amount of our fee at the start of the course in order to commit the client so the client can make best use of his subconscious mind. Otherwise, if the client is going to come to you purely to try out to see if it works, he's quite frankly wasting his time and he is wasting his money. So it's important to impress on the client that they purchase from you a course of hypnosis, just as you have purchased a course on how to become a professional hypnotist.